Section 3403, which establishes the Independent Payment Advisory Board, known as the IPAB. It is the purpose of this section to reduce the per capita rate of growth of Medicare spending, and they gained the authority to cap Medicare spending in 2015.
The Independent Payment Advisory Board, I think, really encapsulates the scariest parts of this law, because you now will have an unelected, unaccountable, appointed board of at most 15 people that are going to be making decisions, life and death decisions, about what Medicare services are going to be available to seniors. And if the president doesn't appoint all 15 members, doesn't appoint anybody, then the Secretary of Health and Human Services, the all-powerful HHS Secretary, has the power herself to make these decisions.
The way that the legislation is written, the way that the regs are written, it literally prevents an active practicing physician from sitting on the panel. There's this whole class of people in Washington, D.C., a lot of doctors who do policy work. And you'd say, well, that sounds like a good thing. At least they have some doctors on board. At least they're bringing in doctors. Oh no, but these aren't doctors. Many of the people who advise the government agencies, who sit on these panels, are physicians in name only, in the sense that once they left medical school or finished their training, they never went into clinical practice. They've never literally had their hands on a patient since then. They've never looked in the eyes of a mother to tell her that her son has cancer. They've been working as administrators and policy people. And a lot of them have PhDs as well as their MDs. These are the folks I call the mudfuds, the MD PhDs. They have a very different attitude and a different philosophy about things. They're number crunchers, and I expect we'll also have our fair share of lawyers, because after all, it is Washington, D.C.
Normally, an advisory panel gives advice to Congress. That advice, if it's good, hopefully is incorporated into the legislation and it passes through the normal process. Now, this has stood on its head with the IPAB. The IPAB's recommendations become law unless overridden by Congress. Let's say the IPAB's recommendations are particularly disturbing, such as no chemotherapy for patients over 65. Might remind you of Barbara Wagner. Well, you can bet every member of the House and the Senate would vote against this, because they would never be reelected if they let it pass. So everyone in the House and the Senate would vote against it, but this recommendation would still become law unless Congress passes cuts of equal or greater value. Now, rest assured, Congress isn't going to cut Medicare by a greater amount than the IPAB, so they'll be able to come back to you, to me, to we the people, and say, boy, this was a really bad idea. We did everything we could to stop it. But it still becomes law. What it does, it gives them plausible deniability. They can come to you and say they didn't like what the IPAB did, but then they can still know that those cuts will become law. The reason behind this is those that were proposing this advisory board believed that Congress would never gain control over Medicare spending. So they thought it was best to delegate this power to 15 unelected, unaccountable individuals and let them make the cuts